All right. I actually really appreciate that I'm going right after that talk because that talk was about, you're a consumer product and you accidentally end up in drug world. And then you end up in a little bit of a mess because you didn't intend to be in drug world. But my talk is more about you think you're a consumer product, but you're looking for opportunities to enter drug world. And what are the opportunities to do that? So I'll start there. My name's Neha Prasad. I'm a senior manager at Rubrum Advising. We're a consulting firm. I work with a team of all-stars at the firm, the former CMO of CMS, former FDA Commissioner Steve Hahn. We've got really cool people doing really cool things, mostly work on market access strategy for emerging technologies. So I'm really excited to share some of our market access insights with you guys about microbiome products. Oh, and I guess I'm a molecular microbiologist by training and have come into the world of consultants. So that's my backstory. So wanted to start off with a quick case study. You guys all know this. The FDA approval of FMT products, Bowsed and Rubiota, have made a huge difference. Before that happened, people were still doing FMT. That was a recognized procedure. Insurance companies would cover it. They would cover the procedural aspect of it, which meant that doctors would get paid for it, the facilities would get paid for it, but then the patient would be left to pay out of pocket for the actual stool preparation part of it, and which really put it at a different price point that was not so accessible for patients, or hospitals would have to do it at a loss, or wherever it's being administered be done at a loss. It'd be done with under physician discretion, not like endorsed by clinical guidelines and as such, because there's no standardized product for it. And so basically what happens is without FDA approval of the stool preparation method, you can't obtain a billing code. And if you can't bill it, then you can't get paid for it. And so that was creating all of these market access issues. So these guys really found a great market opportunity here, and they found a way to standardize the stool preparation methods. And now this has created such a great, way of introducing the microbiome products into I call it the prescription market, but I'm hearing it referred to as the drug, pharma, that landscape of things outside of the consumer product approach. And so now once you have FDA approval, now you can all of a sudden apply for billing codes. Once you have billing code, you can say, hey, use this billing code and you'll get paid for this. And that money goes straight back to the manufacturer. So, and that's how you're able to now create a commercial market in this area. Does that make sense to people? I know reimbursement's a really complicated subject, and I honestly had no idea about any of this when I was a scientist. And so I just want to make sure that these fundamental principles are making sense. Looking for knots or confused faces. Okay, amazing, love it. All right, okay, the other part of this is out-of-pocket costs, right? Like if you go to the doctor's office, if you go to the hospital, there's huge out-of-pocket costs if your insurance company is not reimbursing for the product. And that creates patient access gaps. And so by going through this FDA approval pathway and getting that reimbursement structure in place, you're helping patients access these products. Great. And then, yeah, that lets you get a premium pricing, and then that gets you more sustainable revenue, investor appeal. Great. Okay, so this has been the great debate of the conference, I feel, like over the counter versus prescription. And so basically, like right now, yes, like capitalize on the momentum that is there right now of consumer driven innovation. There's a lot of demand there. It's amazing. But consumers they follow fads, right? Like poppy today, what's tomorrow? It's sometimes it can be a little bit unsustainable. You're not sure if that's really going to give you the stability you need for your business. And so one way to de-risk that is to go after some of these prescription market opportunities, where if you can show clinical benefit, which a lot of these products, even anecdotally, there's some data already existing that shows like, hey, yes, you can avoid the whole like treat, diagnose, prevent disease claims, but there is some data to indicate that there is clinical benefit in that realm, and just using a really creative, smart clinical trial design that can get you that data is going to be the thing that takes you to this prescription area. The other point I wanted to make here is that a lot of you have said that, the microbiome therapies or microbiome products are not like just one-time curative, right? Like you have to keep taking them over and over again. You need repeated exposure. And now what does that mean for me as a consumer, right? Like if every month Seed wants me to pay $50 for their little bottle, right? Every day I take a pill. Like at what point am I just like, okay, this is enough. I don't have the budget for this. And that's just Seed. Now there's going to be some other, for your acne, do this. And for this food thing, do that. Like everyone wants everyone's money, right? And so this becomes unsustainable. At some point, the market gets saturated. There's just a lack of budget to keep up with all of that. And so this prescription approach lets you really target a specific medical condition and provide that clinical benefit for the patients who need it in that way. Great. Okay. So here I put together a couple of market access strategies at a glance. So you guys may already know these, so I'll kind of breeze through these. B2B partnership, you have your technology, you integrate it into another product or service and sell that. You have direct to consumer. That's been talked about a lot, so we don't need to go too much into that one. Provider distributor channel. This is like when you go into the doctor's office or your dentist's office and they're like, hey, we have this rack of products that we also recommend taking, in addition to the treatment that I'm prescribing. That's what this channel is. And there are a couple of companies that are also going after that distribution channel. It gives you a little bit of that credibility in terms of someone's right, a clinician is recommending it to you without that huge burden of going through the FDA. Then you have this payer partnership, right? So this is when you partner with insurance companies and you provide it as like a employer sponsored plan benefit. And it's like a wellness benefit pilot program, that type of opportunity. And there's definitely a lot of opportunity there if you're interested in that pathway. And then finally, this is the prescription approach. That's the one that requires the most amount of clinical evidence to get to. This requires a demonstration of medical necessity. It requires FDA pre-market authorization, time, money, etc. So yeah, these are just some of the different paths that all these different products are likely considering. I mean, let me know if there's stuff outside of this, but to my knowledge, that's what people are doing. And so now if you're really considering the prescription pathway, here's kind of the go-to-market strategy. So the first step is you figure out your reimbursement strategy based on your product design. So depending on if it's used in the inpatient setting, the outpatient setting, physician offices, home use, all of those have a very different reimbursement model. The way it's paid for is totally different, and that impacts your market adoption. It impacts what steps you take in order to accelerate market adoption. And a lot of companies think about this after they get their product to market. And by that point, you end up again in like no man's land. And it's like almost too late to come back and develop that reimbursement strategy. So we always encourage companies to think about it as early as the product design stage, exactly how that product is going to get paid for. This also demonstrates your commercial value to investors, and adding this extra narrative in your pitch, we've found is really like improves your appeal to investors. So the second thing is proving your clinical benefit for medical conditions in strategically designed clinical trials. So this is just about taking a very creative approach. It could be real world evidence, doesn't have to always be RCTs, because what I love about the microbiome space is a lot of things are already safe as compared to like a lot of these therapeutics and small molecules out there. It's pretty well accepted, the safety threshold of these. And so you can actually target a very different population of patients with a different level of indications that maybe wouldn't be possible using higher risk products. Does that kind of make sense to people? Like the risk benefit equation is tipped in the favor of these microbiome products here. Great. Okay, then the next step is if you engage your clinicians and provider key opinion leaders towards integrating your product into clinical guidelines, this is what gets the clinicians to buy in, right? And this is how they know when to prescribe your product, for what indications, which patient populations. This is where your value proposition is really demonstrated. You can figure out, are you first in line, second in line? That's really where all this happens. And the key to this is really getting that early engagement with KOLs so that you can understand from their perspective, what is the data they need to see in order to feel comfortable prescribing the product. Great. And then the last two steps are, really this is just talking to payers, figuring out, well, what is it that they need to see in terms of medical necessity? If you're talking about people who are under 65 and your product really targets that population, you're not going to be looking at Medicare, right? You'll be mostly looking at the commercial payer group. That's a very diverse set of people. Each of those requires a different conversation, and you're going to have to figure out, like, what is your plan to get reimbursement under each of those. If you're really targeting patients over 65, then your life is a little bit easier because you can start with Medicare, because they are like the largest single payer in the United States for that patient population. And whatever CMS does, most of the time, the commercial payers follow. Medicare Advantage follows. So that's a very defined pathway. Great. And then basically all this is to say that once you create this clinical pathway all the way to payer coverage, you can use that as a competitive advantage barrier, right? So now no one else can really come in after you without having that same level of rigor of clinical evidence, and then start selling to the same crowd. So this really puts up a nice barrier for you, and that will make up for the price of going through all of the efforts of clinical evidence generation. All right, this is kind of a snapshot. Like if you think of it from a payer perspective and you have to ask them to, like, how likely is it that they will cover or they will consider any of these types of products as, medically necessary? Therapeutics, yeah, more or less, a lot of therapeutics get covered. Then you start going to nutraceuticals, right? And you enter this weird world of, well, is it medical food? Is medical food a covered benefit category? It's not, fun fact. And so, you need a lot of advocacy around there. Then you go to diagnostics. Some diagnostics, yes, but then if you enter the world of screening and, like, should everyone get screened? Should we test everyone for everything? You hit reimbursement challenges there. And then finally, cosmeceuticals. I put them here now, but in the next slide, yes. In the next slide, I want to really talk about opportunities to move them more on the right side. Is that right? Left side to you. Yeah. Great. Okay. So here's my slide of prescription market opportunities. So, I'll start at the bottom, cosmeceuticals, right? So right now, if you're just cosmetics, you're not going to be able to find a reimbursement opportunity there. But if you're able to say that you're treating a diagnosable medical condition, you can. I've heard a lot of talks already today where, maybe dandruff by itself is not a medical condition, but there are other medical conditions out there that share similar properties as solving for dandruff. And you can go after some of those. For example, like acne, eczema, psoriasis, these are all recognized medical diseases, and that insurance companies will pay for solutions to these. Next is the functional foods and supplements category. I thought this was really interesting because right now medical foods are only reimbursable if they're formulated for, like, tube feeding. Or if, like, you're in a specific Medicaid plan, but it's not generally covered. So if you have an oral medical food, it's not reimbursable. And you think, in hospital settings, all these patients are being served food. Food can have a very therapeutic value associated with it. And yet it's not something that we really take advantage of right now. And we haven't done the work to really get it there. And so I really think that there's a huge opportunity here to turn medical food, microbiome integrated medical food into something that's, like, more prescribed or seen as adjunctive therapy almost. Then there's infant nutrition. And again, like, normal general infant formulas are not reimbursable, and so if they're microbiome friendly, even things like that, it's generally not reimbursable. But if you're able to establish a medical need for a specialized, nutritionally tailored formula, then you can justify reimbursement. And so this strategy is all about putting out papers that show, hey, here's the difference between infants who receive this formula versus like a microbiome enhanced formula versus not. And here's like the different disease states, allergies, immune, all these different applications that we're already seeing so much research come out of this type of work. And it's just about really getting it out there in terms of the lens of medical necessity. And so it's really about how are you packaging the evidence in a way that's usable by all these different payers as they consider reimbursement for these different products. And then finally, therapeutics. You guys might have seen, I'm from the antimicrobial resistance space, so that big FDA workshop that was all about decolonization and how they were like, it's really hard to prove decolonization. And that was a big setback for the microbiome modulation therapeutic space, because now they're saying like, you need huge clinical trials in order to prove that, if you deplete this exact bacteria, it has an actual clinical benefit. And yet, if you look in hospitals, it's like, these chlorhexidine baths are so common. There's so many of these infection prevention control products that are in use, even though they're not quite approved under modern FDA. So there's a lot of opportunity here to think through in terms of how do you prove microbiome modulation and clinical benefit are linked without a crazy clinical trial design. Okay, I believe I'm getting towards the end. This is just a little bit of a heads up. Again, the medical foods, in case people aren't aware, Congress defines what exactly Medicare can cover. So this is not CMS saying, oh yeah, we're just not going to pay for that. It's actually, Congress saying you can or cannot pay for this. And so if people are working on medical foods here, I really see a great opportunity here, especially all these national coalitions that are working on a specific act called the Medical Nutrition Equity Act, in order to push for Congress to recognize medical foods, things that are served in hospitals, for example, or long-term care settings, to be reimbursed. Great. So basically, if I had to sum it up, if you have a technology, you can productize it in a lot of different ways. They each have various downstream implications. The earlier you think about all these downstream applications, the better it will be in the long run. And I can name a lot of fun stories I have from the 50+ clients we worked on in the last 2 years of just like, hey, my product has, like my medical technology has a scale integrated as part of it. And I'm going to take it through FDA, everything's fine. And then you talk to CMS and they're like, oh, well, a scale can be used in the absence of illness or disease. And so we're not going to cover this because it's not like an actual medical device. So it's all these like tiny, silly little things that get in the way. And so we at Rubrum Advising really want to help people who are taking amazing science and turning it into really clinically impactful products for patients, avoid some of these problems. Yeah, I think that's pretty much everything I wanted to say, but happy to take any questions because I know, again, CMS reimbursement is sometimes like a black box that I'm only starting to get through. So yeah.